The views and opinions expressed on the show by the host, speakers, and doctor experts do not reflect the views of Johnson & Johnson, Johnson & Johnson Philippines Inc., or its respective management. Viewer discretion is advised.
Hi everyone, I'm Apple Mendoza and I'll be your host for today's session of Bacterial Sore Throat Management 101. So today we're going to learn all about sore throat, its causes, its symptoms, and the best ways to treat it, of course. So we all know that the times are tough right now, and I know everyone is so concerned about their health. Everyone wants to stay healthy and keep their families and friends healthy too. I know everyone can relate to this one, but by now we're super familiar already with the proper hygiene and safety protocols to prevent us from getting sick, right? But what if you start feeling something in your throat, yung alam mo yung konting kate or even a slight pain when swallowing? That's no cause for panic, but of course, we need to know all about it so we can address and get back to our full health. Okay, so that's why we are here today for Back to Those Sore Throat Management 101. So it's time for a crash course on sore throat so that we know exactly what we are dealing with. But before we start, I'd like to encourage everyone tuning in to stay till the end of our program because we have a fun little game for all of you guys. So today, Bactidol has invited two doctors who know all about sore throat and how to manage it best. So we have Dr. Teresa Cruz, who is an ENT specialist, that's ears, nose, and throat. And of course, we have Dr. Anna Ong Lim, who is a pediatric IDS or infectious diseases specialist. Both doctors are practicing in PGH. So Dr. Tech is also practicing in Asian Hospital and Medical Center, while Dr. Anna is also practicing in Manila Doctors Hospital. This is a JMJ initiated FB Live, and Dr. Tech and Dr. Anna are engaged by J&J to discuss topics related to this. So good evening. Hello, doctoras, and welcome to Sore Throat Management 101.
Hi, Apple.
Hello.
Hi to everyone watching.
Yes.
Good evening, Apple, and good evening, everyone.
Yes, good evening, Dr. Tech and Dr. Anna. So, yeah, I was buckling kanina. I was a little bit nervous, but I'm so happy that both of you are joining me right now. So, thank you once again. So, Doctora, should we get right into this one? Yes?
Sure.
All right. So, class is in session now. So, let's start with the basics. Doc, what is sore throat?
Okay, so I'll take that one. Sore throat is actually pain in the throat most of the time. But you will realize that when someone says he or she has a sore throat, it doesn't always mean that it's pain in the throat. Especially in the vernacular, our patients will sometimes say, Doktora, may sore throat po ako. And then when you explore and ask them more details about what they're feeling in their own words, then you find out that they are actually probably also complaining of itchiness in the throat or any throat irritation like a feeling of meron pong parang nakastuck sa lalamunan ko or pwede rin pong magaspang po ang lalamunan ko or dry na dry. Sometimes they also equate sore throat with difficulty in swallowing or pain in swallowing, and sometimes also hoarseness or yung pagbabago sa boses. They also can say that. Right, classmate?
Yes, Tech, no? I think that's a very broad description of what people usually mean when they say may discomfort. Siguro from the pediatrics perspective, ang mahirap pa pati, marami sa mga bata non-verbal. So all we can do is look at cues about how they behave. Pwedeng mag-decrease yung kanilang feeding frequency and volume. And isa sa mga presentations in kids is they will have a fever, and then it becomes the job of the healthcare provider to actually check out the different systems that might be causing the fever, which can include a sore throat.
Okay, so thank you for that one, Doc Tech and Doc Anna. So in line with that question, so what are the symptoms of sore throat for everyone?
Yeah, sore throat is actually a symptom already. And as I said, in general, if you look at the literature, sore throat is pain in the throat. So it can stand alone, or most of the time it has other symptoms associated with it. If it's due to an infection, you may have fever, and you may have, especially if it's a viral infection, you may have weakness, you may have feeling of tiredness, loss of appetite. And as I mentioned earlier, there may be changes in the character of the voice, difficulty in swallowing. So those are the different symptoms that can accompany sore throat.
Okay.
So,
we will-
Apple, if I can add to that,
Yes, please, Doc Anna.
what Dr. Tech has shared primarily are related to sore throat symptoms that might be associated with infections. But we also need to realize that sometimes sore throat is not really due to an infection. It can be brought about by some kind of irritation, or can be associated with allergies because of postnasal drip. So in those cases, then you might not expect fever, but you might also still have some kind of nasal discharge, congestion. Perhaps if you're exposed to environmental pollutants, that can also be a trigger for the sore throat, and those can be symptoms that you might want to elicit, like some kind of itchiness, for example, or perhaps some rash, pwede rin kasing associated with sa allergies.
Yes. You know what, Doc? I remember all the times I had it. Sobrang hassle talaga. So what I want to know is, what exactly causes it?
So I think I'll take that one first and focus on
Okay.
the infectious disease aspect.
Yes.
Yung medyo nakakakabalang kasi talaga is if it's related to an infection, there are certain infections that can actually produce a very severe complication. No? Meron kasing mga bacterial sore throats that are associated with long-term consequences on the heart. So that's really why there's a need to examine carefully whether a patient complaining of sore throat and fever might possibly be infected with a bacterial pathogen or a bacterial organism. Although in most cases, viral yung cause, self-limiting, very mild or relatively mild ang symptoms, and doesn't really need a lot of treatment. Etch, would you like to add?
Yeah,
ahead,
thank
Doctor.
you. Whenever someone asks me about the causes of sore throat, I really like that question because it opens up so many possibilities. Because people, of course, the most common notion is that sore throat is just due to infection, which admittedly so. Most of the sore throats that we encounter in clinical practice are due to infections. And that's the number one cause. Kasi pag sinabi mong masakit ang lalamunan ko, infection ang pinaka-common cause na kailangang agapan. At gaya ng sinabi ni Dr. Ana, out of all these infections, actually, only 20 to 30 or even 10% only may be bacterial, especially in adults. 80, 70 to 90%, average 80% are viral, and so they are self-limiting. So number one cause, infection. Other causes, as Apple has asked, number two would be allergies. No, even food allergy can cause some throat irritation. Irritants like smoking, pollution. Then Apple, like my patients from hosts like you or call center agents, fatigue or muscle strain, shouting, use of voice can lead to pain in the throat. There's also very common nowadays because of the foods that we eat and our lifestyle, acid reflux. Yun po yung kondisyon ng asido galing sa tiyan. Dapat po ang acid sa katawan nasa tiyan lang. Pero dahil sa mga kinakain natin at sa stress, pwede pong umakyat ang acid mula sa tiyan, makarating sa lalamunan at mag-cause ng sore throat. Another thing po, sore throat, when you ask the patient, if the patient says, Doktora, sa kanan lang po, sa kaliwa wala, magtataka ka na. Anong nasa kanan ng lalamunan? Ang infection usually the whole throat. O pwedeng may singaw sa isang bahagi lang ng lalamunan, ordinary aphthous stomatitis, or even natinik. Natinik po ako nung Sabado pa, hanggang ngayon po, masakit pa rin ang lalamunan ko. Naku, ba't hindi ho agad kayo nagpunta? Lunis na ho ngayon, baka nakabaon na yan. And then, syempre po, meron din pong not very common as a presenting symptom, pero kailangan din po nating mag-ingat kasi some tumors o mga bukol po sa lalamunan can also present as sore throat. And last but not the least, meron din po tayong tinatawag na referred pain. Masakit ang lalamunan mo, pero ang infection mo nasa tenga. Dahil po ang ear, nose, and throat magkakakonektado. At kahit minsan you really don't have anything in your throat, pero sa tenga ka may problema, paglunok mo, masakit din sa lalamunan. So those are the various causes.
Okay, thank you so much, Doc Anna and Doc Tech. Right, I agree that bacterial and viral infections can be quite different. And also, thank you. We'll dig deeper on that one, the last one that you mentioned, Doc Tech, about hosts and people who, who works in, conversing and talking a lot. So later on, so for all of our viewers right there, kung meron kayong questions about it, just drop your comments on our comment section below. So we can go right into that later on and we'll try to answer your question. So Doc Anna, I'd like to know how different is sore throat from children and from adults like us? How different?
So that's a nice question, no, Apple? Kasi you kind of think, bakit naman magkakaiba yan? Pareho lang namang throat, di ba? Pero typically, kasi sa bata, that's because their immune systems are still just trying to learn how to defend their bodies against infections. And of course, their exposure to environmental pollutants is typically less over their lifetime kasi mas maiksi naman yung buhay nila, mas maliliit pa silang bata. No? Ang una talagang default ng clinician na tumitingin sa bata, nag-entertain siya ng diagnosis ng sore throat is infection ba to o hindi. Yun ang una mong iisipin. And then typically, merong ibang mga kasabayan na symptoms. Ang bata kasi pagka may infection talaga nagkakalagnat halos parati. Yes, again, as part of the defenses, di ba? So, mas typical siguro yung presentation ng sore throat and fever in children rather than sore throat and fever in adults. Tapos, yung isa pa is yung potential for, again, yung nabanggit natin kanina, allergies being the cause of a sore throat. And that shouldn't be taken away from the equation kasi unfortunately, ang dami na ngayong may allergies, di ba? Halos lahat ng kinakausap natin, meron silang allergies of one form or another, and that can also manifest as sore throat.
Doc Tech, would you like to add to that?
I think it's very important also, as Anna said, to detect different kinds of symptoms sa mga nanay po natin. Hindi po talaga makaka-express minsan ang ating mga anak na bata na masakit ang lalamunan, but you have to observe the behavior, yung gana po sa pagkain, yung pagkamatamlay, mahirap lumunok. Minsan nagsusuka pa, classmate, kasi hindi niya malunok. So, yung vomiting can be a sign. At very important, ang atin pong mas significant na infectious tonsillitis caused by bacteria, maaari pong narinig nyo na yung term na strep throat. Ito po yung sinasabi kong 10 to 30% lang ng lahat ng infeksyon ng tonsils o ng lalamunan. Ito po ay actually mas common sa pediatric population. Sa adults po, mas common ang virus. At gaya po nang na-point out ni Dr. Ana, maari po tayong makaagap nito dahil ang isa po sa pinaka mahalagang layunin ng pag-agap dito ay para po maiwasan ang hindi kanais-nais na mga komplikasyon. Kasi kahit po napaka-common, minsan po nasa cartoons pa ng mga bata ang tonsillitis, ito po ay paari pa ring magdulot ng mga delikadong outcomes pag hindi naagapan.
I agree, Doc Tech, Doc Ada. It all makes sense. And especially now, diba? I know everyone's more aware of, proper hygiene because of the pandemic. And speaking of, how is sore throat related to viruses and other diseases, Doc?
So, if I may, no, Tech, I'll take that
Yes,
question.
please.
So, I think lahat naman tayo, nung pinakikinggan natin yung mga common symptoms ng current infection, no, si COVID,
Yes.
nababanggit parati ang sore throat na yan.
Yes, Doc.
No? So, syempre, bilang parents or even as individuals, pag may nararamdaman tayo, syempre may konting panic. Ano ba yan? COVID na ba itong nararamdaman ko? No, pero, as we mentioned, ang sore throat kasi can be caused by a lot of different viruses. And tama naman na isipin or isama na dun sa tinatawag na differential diagnosis or possible causes yung COVID, pero it's only one of many, many different viruses and a few bacteria that can cause sore throat. So siguro ang pwede kong ma-share is wag magpanic, no?
Yes.
In more often than not, it's probably not COVID. Lalo na kung nag-iisang simptomas lang yan. And a consultation with your healthcare provider will be able to reassure you by helping you find out kung ano pa yung pinagmumulan para maagapan.
I agree, Doc. So you have to be calm and collected, especially during this, season. So, Doc Tech, would you like to add to that one?
I also just want to say that based on a study in China, among 55,000 adults who were COVID-19 positive, only 14% had sore throat. What does this tell us po? Na sore throat is not really very common in the current crisis that we have. Although, as Dr. Anna pointed out, it's always, kasi meron ngang asymptomatic 10 to 11%. So, syempre, hindi natin maiwasang mag-isip ng ganon. Pero just to point out, ang pinaka-common pa rin po sa ating current crisis is fever, cough, and fatigue. So sore throat, as Dr. Anna said, alone, without those other common symptoms, don't panic. Most probably, you can stay at home if you just have that. Kahit naman po, at the worst case scenario nowadays, if you just have sore throat, you can stay at home and do your first aid treatments. Also, as Dr. Anna said, of course, consult your healthcare professional if you have concerns.
Yes. So imagine, Doc, no, just a simple sore throat that could actually lead to something worse. So I get it now that we should really treat sore throat on the onset. Kaya kailangan agapan agad ang sore throat. I know everyone would agree with me. Right, Doc Anna, Doc Tech?
Yes, I think it's prudent, no? Lalo na kasi ngayon, alam naman natin na may limitation in terms of accessing healthcare facilities. So kung may nararamdaman na magandang hindi pinatatagal, magandang may opportunity to talk to your healthcare provider even through teleconsults so that you can be advised proper intervention at the earliest possible time. Kasi syempre ayaw nating lumalala ang simptomas natin. Kung dati, ayaw natin nun, mas lalo nating ayaw yan ngayon kasi medyo delikado talaga ang panahon.
All right, so Doc, how do we exactly treat sore throat?
So, yes, so of course, as we always say in medicine, in clinical practice, you always want to treat the root of the problem. Yung ugat ng problema, gusto mo sanang tumbukin. So kung ang sore throat, as we said, is mostly due to infection, as we are talking about it now, then you want to treat that infection. And as we said, the most common is a viral infection and a certain percentage is bacterial. So between these two, actually across the board, you can already do your general management. You can take paracetamol for the pain, increase your fluid intake, increase your intake of warm fluids, and of course, there are always measures like oral antiseptics that you can use across the board for infections of the throat, tonsillitis, pharyngitis, whether it's viral or bacterial. And as Dr. Anna said, personally, even without the consult yet with the healthcare worker, if you have some low-grade fever and some sore throat, I think an oral antiseptic and other supportive management measures that I mentioned can already help the patient at the onset.
Okay, so I see that, Doc. So let me just take this one out. So a hexetidine solution like Bactidol, like the one I have over here, is able to kill sore throat causing viruses in as fast as 30 seconds. And after you gargle, it can protect your throat against sore throat causing viruses for up to 12 hours. So now it's always best for you to be prepared. That's why you should head on over to Watsons online. That's www.watsons.com.ph or to your nearest branch and get your Bactidol after this session so that when you feel that itch, maagapan agad ang sore throat. And of course, aside from oral antiseptics, there's a lot of home remedies for sore throat out there. Actually, docs, I remember my mom used to make me gargle warm water and lalagyan ng salt. I know everyone can relate to this one. So I've seen people also drink hot tea or, hot water with honey. So what is the best one out there in terms of home remedies?
So Apple, siguro babalikan ko yung nabanggit kanina ni Dr. Tetch, ano? Ang remedy kasi, ang effect niya will be the best kung malalaman natin kung ano yung pinagmumulan ng symptoms. So what you mentioned, like drinking warm water, gargling salt water, maybe drinking preparations with lemon and honey and tea and all of that, no? They're really classified as soothing remedies. And nothing wrong with that, no? They work. I guess the thing lang is we have to be realistic in terms of our expectation. They will soothe and they will be temporary. So kung ang pinagmumulan is an infection, then iba naman ang approach natin. No? Ultimately, you might need to take an antibiotic if it's proven to be bacterial or wait for it to resolve if it's viral. And there can be a place for oral antiseptics.
I would also like to add that since Dr. Anna and myself have been pointing out since the start na majority of infections that cause sore throat are viral in origin. Anong ibig sabihin nito? Hindi kailangan ng antibiotic. Paano po ba, doktora, malalaman kung viral o bacterial? Ang doktor po usually ang nakapagsasabi niyan. Pag bacterial po ang infection, usually po walang ubo. Pag viral, ang sore throat, may kasamang ubo, parehong may lagnat, parehong infection eh. Pero pag medyo may fever na 38.1 at pagtingin po sa lalamunan, may nana ang tonsils, yan na po ang mga ginagamit naming bantayan kung ito po ay bacterial. Meron idagdag nyo pa po yung kulani sa liig. Pag meron pong masakit na medyo malaking kulani, usually po tinitreat na namin yan as bacterial at nagbibigay na po ng antibiotic not only to treat the symptoms but to hit the root of the problem, prevent complications, and one more important thing, studies have shown if you give your antibiotic for strep throat, in about 24 hours after, the infectivity of the sick person is reduced by 80%. So, hindi ka na masyadong nakakahawa pag nakapag-antibiotic ka na. But then again, mas less common nga yung bacterial. Ayaw nating mag-a-antibiotic ang may sakit kung hindi necessary.
Yes, Doc.
Kaya as I said, across the board, oral antiseptics have a very important role. Why? Because it usually starts also, some diseases, some bacterial diseases can start from a viral infection first, and then pag hindi na treat ng mabuti, correct me if I'm wrong, classmate Ana, nagkakaroon ng superimposed bacterial infection. Imbis na maagapan na sana from the start nag-oral antiseptic na at namatay na yung virus, because oral antiseptics like Hexetidine can kill viruses. The common viruses that cause the flu, influenza A, also rhinovirus, the one that causes common cold, and herpes simplex. Herpes simplex virus is susceptible to Hexetidine. So if you can use your oral antiseptic, then you can prevent the progression of viral illnesses to more serious bacterial illnesses.
All right, thank you so much, Dr. Ana and Dr. Tech, for that one. So everyone watching our Facebook Live, alam nyo na, on the onset pa lang ng sore throat, may konting kate, you know what to do. Grab your Bactidol. Yan. All right, so thank you, Doc. So that was truly a crash course, full of knowledge. And I know it's a lot to process for most of us. But of course, we need to come away with, remembering all those important information. So why not test our knowledge with a little game as promised earlier? So to all of our viewers, I will be asking some questions, and all you have to do is write down fact or fiction on our comment section, and then Dr. Ana and Dr. Techi will reveal the right answer. So is everyone ready on our FB Live? Okay, so let's start. Okay, it's test time. So Doctoras, let us know if the following statements are fact or fiction. So number 1, is it a fact or fiction? Sore throat can be caused by bacterial or viral infections. So to all of our viewers, okay, write down your answer. Is it a fact or a fiction? Okay, we'll give you 5 seconds. 5, 4, 3, 2, 1. Okay, Doc, is it a fact or a fiction? Sore throat can be caused by bacterial or viral infections.
So my answer is fact, no? As we have been talking about earlier, one of the major causes of sore throats are really infectious pathogens or infectious agents. More often than not, they're viral. Occasionally, they're bacterial. And since these are pathogens, microbial organisms, then antiseptics can be helpful in their management.
Okay, so I hope everyone got that correctly. Okay, so for our next fact or fiction, so I hope everyone's ready. Number 2, sore throat is how cough, colds, or flu start. So is it a fact or a fiction? Sore throat is how cough, colds, or flu starts. Okay, everyone, so let's give you 5 seconds again. Okay, time's up. So Doctora, sore throat is how cough and cold and flu starts. Is it a fact or a fiction?
Tech, ako ba to? Infection ulit eh.
Yes, please.
Go ahead, Doc.
Sige. So, parang pwede bang sumagot ng trolls? Pero siguro yung best answer na lang dito, fiction. Kasi hindi parate. Baka yun yung point, no? Baka naman kasi matanim sa isip ng ating viewers na, ay, pagka may sore throat, parating infection. I guess the point of this question is not 100% of the time, no?
Yeah.
So, merong mga infections that start off as a sore throat, but as we also mentioned earlier, may mga sore throat that are because of irritation, because of allergies, and at the outset, parang mahirap sabihin kung alin silang dalawa. Siguro puwera na lang kung nagsabay na may fever. No?
Okay.
Pagka may fever, then you kind of think, ay, infection siguro yan.
Okay, so there you have it, everyone. To all of our viewers who got that one correctly. Congratulations. And now, on to our next one. Okay, so yan. I'll be reading this one out. So sore throat always goes away with home remedies like gargling saltwater and ginger tea, etc. So is it a fact or fiction? So let me repeat that one. So yeah, let's give them a little bit of time, Doc Tetch.
Okay. Sorry.
Fact or fiction?
Excited.
Okay. Okay, time's up for everyone. Ayan, let's give the floor to Doc Tetch. So Doc Tetch, ano nga ba ang sagot?
Apple, repeat the statement.
Okay, once again, sore throat always goes away with home remedies like gargling salt water, ginger tea, etc. So is it a fact or a fiction?
Kung teacher ka, hindi na agad acceptable yung true or false question.
Okay.
Kasi by always.
Oo, bilang mga estudyante, alam na yan ng mga estudyante, pag may never, always, usually false yan.
Okay.
So, we want to say that home remedies or supportive care, rest, voice rest in particular, resting your throat, hydration. I always say water is your best friend, warm fluids, comfort foods. They have a role in the management of infections, especially viral infections, but they do not always work. We say that gargling with warm salt and water only soothes, but it does not kill the etiologic or the cause, the etiologic organism, viruses and bacteria. So we always advise for infections that adjuvant therapy with oral antiseptics can really be helpful. Also, I would like to point out that always that it can really prevent progression into more serious conditions. So I think that actually oral antiseptics nowadays are home remedies already. Most of the time when I take the history, my patients also have already started gargling. I also want to point out that although lozenges are very popular because they're very convenient, you can just carry them in your bag. You know that gargling, because of the mechanical effect of removing the irritant or the viruses and the bacteria, are preferred by ENT practitioners rather than lozenges.
Yes, Doc. The fact that you're spitting it out.
Yeah, because of the mechanical effect of cleansing the throat and the oral cavity.
Okay, so everyone, ayan, kaya kapag may sore throat, it's best to treat it na agad with an oral antiseptic like, of course, Bactidol. So it is able to kill sore throat causing viruses in as fast as 30 seconds. And of course, it protects your throat for up to 12 hours. So don't forget to get your Bactidol at Watson's online or any Watson's branches after this session para maagapan agad ang sore throat. Okay, so now we are going to move on to our fourth fact or fiction. So everyone listen. So there are a lot of symptoms of sore throat aside from pain and itchiness. So let me repeat that one again. So this is our fourth fact or fiction. So there are a lot of symptoms of sore throat aside from pain and itchiness. So is it a fact or fiction? Okay, let us give them some time. Okay, 5, 4, 3, 2, 1, ding, finish. Okay, Doc. So once again, I'm going to repeat that one. So fact or fiction, there are a lot of symptoms of sore throat aside from pain and itchiness. Ano nga ba, Doc, ang sagot?
Etch, walang always, so okay na, no?
A lot lang.
Oo, a lot. Yes, the answer is true, no? That's a fact. We mentioned earlier, no, na pwedeng mag-present as yung typical na discomfort, pain, itchiness, pero pwede rin yung hoarseness, pwede rin yung voice loss, pwede rin yung fever, di ba? And many other associated symptoms na pwede nating sabihin, wala naman yan sa throat tulad ng nasal discharge, even cough, no? So the thing is, the doctor or your healthcare professional is responsible for putting all of these little pieces together so they can try to figure out what the possible cause can be and help decide or use that information to decide what's the best course of treatment.
All right, so there, let's see who got it correctly. Ayan. So everyone is paying attention, Doc. Okay, maraming nakakuha ng correct answer. And now we are going to move on to our fifth and last fact or fiction. So this is the last one. Sore throat is a sure sign of sickness. Is it a fact or fiction? Okay, let's give them time. Okay, 5, 4, 3, 2, 1. Ding! Okay, so ayan, you have inputted all of your answers. So Doc, is it a fact or fiction that sore throat is a sure sign of sickness?
Apple, kung ako ang dean at faculty kita, ibabalik ko na naman yung question. May sure na naman. So, fiction. Okay, sore throat is not always due to a disease. As I mentioned earlier, like hosting, our call center agent patients, just by simple fatigue, you're not yet infected, but because of the fatigue, because of dehydration, because of irritants, you may have sore throat. But again, if it's a disease, the most common cause is an infection. But I'd like to point out that oral antiseptics have a role in all this, even without sickness yet. Because oral antiseptics like Hexetidine in particular is actually not just an antiseptic or an antimicrobial. I consider it also as deodorant, as an astringent, as actually an analgesic. It also has a soothing effect. So even if you don't have the disease yet, you're just starting to have the irritation, even if it's not yet a full-blown infection, I think that there is room for the use of Hexetidine for throat irritations and other oral antiseptics.
All right, thank you so much, Doc Tech and Doc Anna. So that is it for our short review. I hope everyone learned a lot. And now we are, it's more clearer to us what sore throat really is, and of course the facts and the fictions that goes with it. So thanks again, Doctoras, for taking us through the basics of sore throat. I know I've asked all my questions, but now it's time for our viewers to send in their questions as well, yung mga hindi natin nasagot earlier. So all you have to do is leave a question or your question on our comment section below, and we will do our best to answer them. So everyone can start typing in their questions, and let's see. Ayan. We're gonna pick out a few questions. Okay, Doc, so we have one right here. Okay, I'll be reading this one out. So is it true that sweets and cold or maybe cold drinks may potentially cause sore throat? Is it true? Yes, go ahead, Doc Anna.
Oo, Tetsa, sundan mo na lang kasi parang may pagka-element na naman ng trolls ito eh. No? I guess yung point lang naman kasi is if you were following our discussion earlier and when we talked about different causes of sore throat, not all sore throat is infection. I guess that's the main thought, no? And having said that, then it's possible that certain food items, certain drinks can cause some kind of irritation and therefore can lead to sore throat. So I would put this in that category. Pagka nagkataon na meron palang sensitivity or food sensitivity itong taong to, then trigger sa kanya yung pagkain ng sweets or pag-inom ng malamig, or also, minsan nagkakataon kasi na magkakasakit ka na pala, tapos akala mo, yung kinain mo, siya yung naging source ng discomfort. Oo, natapat lang.
Okay, so there you have it. Yes, go ahead.
Yes,
Doctor.
I just want to add to that. Very important yung sinabi ni Dr. Anna that there is a certain predilection to sensitivity to these foods. Kasi I get asked most of the time, Tita Doc, pag kumain, bawal po sa kanya ice cream, no? Bawal po sa kanya ice cream. Ayaw pakainin ng At saka chocolate ho, di ba? Bawal ho sa anak ko.
Kawawang bata.
Kawawa, para yung bata.
I'm guilty,
Siyempre,
Doc.
sabi ko, Apple, sasabihin ko sa mami, pasensya na po, pero sa totoo lang po, ang rule ko po lagi is anything too much is bad. Ayaw ko naman hong parusahan yung anak mo na i-condemn ko na ho siya na wag na hong kumain ng chocolate at saka ng ice cream. Nung bata ho tayo, gustong gusto din natin yan. So, unang-una ho, everything in moderation. Imbis na isang bar ng chocolate, dalawa lang munang squares. At sundan po lagi ng pag-inom ng tubig.
Yes.
Di po ba pag kumain kayo ng chocolate, tas natulog kayo, hindi na kayo nag-toothbrush o uminom, pagising nyo sa umaga, masakit na lalamunan nyo, mag-hexetidine na kayo.
Yes.
Kailangan po, prevention is still the key. As I said earlier, water is your best friend. Every time you eat something, even if you already drank soft drinks, even if you already drank iced tea, water is still the best liquid that will be the last to touch your throat.
Okay.
So, don't say across the board, nakaka-tonsillitis po ang malamig, nakaka-tonsillitis po ang matamis. Hindi naman. Pero admittedly, as Dr. Ana said, meron talagang iba kahit konti lang, meron na. Wala tayong magagawa doon. Kung nakita na yung pattern na ganon, then please avoid those kinds of irritating foods.
Okay. Thank you so much, Doc Ana and Doc Tetch. Meron lang akong quick personal question kasi in line with that one, I'm also a parent of an 11-year-old. So what I do is every time or after he consumes anything sweet, pinapainom ko siya ng warm water. So does it help or is there a difference, Doc, kung warm water siya or, regular temp water? I just want to know. Is there a difference?
That you want to go ahead?
Yes, regular room temperature water is okay. Again, extremes are not advised. Very hot and very cold foods and beverages can really irritate the throat. And Apple, that's very good practice. Water really after eating sweets or cold foods and beverages. Or yung mga pulburon, yung mga peanuts,
Doc.
yung mga powdery na may
Powdery, that's irritant, yeah.
Yes, may tendency mag-stick sa throat. Lalo na ang tonsils natin are not smooth. They have crypts where food can lodge. And this can cause irritation and even infections later on.
Okay, thank you so much, Doc. I hope the parents out there are paying attention. Okay, so second question from our Facebook viewers. So, how do oral antiseptics like Hexetidine work against sore throat?
So
I
as
think,
as the word implies, no, it's an antiseptic. So it's actually an agent that prevents sepsis or another term for infection. No? So it is able to kill the viruses and the bacteria that are potentially present in the throat that could be causing the symptoms that you're feeling. So in a way, it is like an antibiotic, no? Kaso nga lang, yung mechanism of action is a little different, but the end result is the same. It kills the organisms and therefore prevents progression of symptoms if the symptoms were due to that infection.
Okay, thank you, Dr. Ana, for clearing that one. Okay, so let's proceed now to the third question. Okay, so we have, how long do I wait before I treat sore throat? Wag naman sana maghintay na sobrang sumakit. Go ahead, Doctor.
Actually, don't wait.
Yeah.
Because treatment is not all chemicals. As we said, there's a lot of room for supportive management. If you already have sore throat, no matter how mild it is, no need to wait. Be conscious of your problem. Be conscious of what you're feeling. Drink lots of warm fluids. Take a rest if you can. No unnecessary talking. Even whispering is an effort on the throat. So just voice rest as much as possible. And then for ito, infectious disease specialist si Dr. Ana, pero mag-a-attempt ako. If it's a viral infection, which is the more common cause, fever usually goes up rapidly. The symptom of fever is high in the first 2 days for most viral infections. It starts to go down after the second day, but the respiratory symptoms of sore throat may just be peaking at the third to the fourth day. If it's a viral infection, at the fifth day, it will start to improve. So if it's a viral infection, the fever should be lice by the third to the fourth day. So you should still rest, use your hexetidine or your oral antiseptic. And if you are not getting better by the fifth to the seventh day, or worse, you have a worsening within the week or by the 10th day, then it's most probably a bacterial infection. You really have to go and see your healthcare professional already.
Okay, thank
Apple,
you.
siguro if
Yes.
I can add to that, no?
Yes,
Siguro
Doc.
kasi yung perspective no nagtatanong, treat as in may nireseta or may iinumin, no? But as we mentioned and as Dr. Tech has shared, marami tayong pwedeng gawing home remedies that can also
Yes.
be considered as treatment for a sore throat, no? So those
Yes,
soothing remedies can help, avoiding certain practices like shouting, whispering can help, giving paracetamol for pain, no? That's something that's readily available at home, can help. You can take your, or you can utilize your oral antiseptics and gargle so that you can try to clear out the organisms if they're there. And then if those don't work, then, and of course, if the symptoms persist, then you kind of think, sandali lang, hindi nawawala, hindi gumagaling sa home remedies, eh baka nga bacterial yan, in which case, kailangan mo na talaga magpareseta ng antibiotic.
Yes, I agree, Doc Anna and Doc Tech. So again, a quick takeaway for that one is wag maghintay that you feel like, a sting of pain. So agapan na agad yan on the onset, right, Doc? Okay, so our fourth question from our Facebook live viewers. Okay, yung sister ko po, may sore throat siya ngayon. Parang may sugat or may nana sa, I hope I'm pronouncing this one correctly, Doc, sa uvula or uvula niya. Okay, so parang may sugat or may nana sa uvula niya. Ano po ang dapat niyang gawin?
Ang galing, no? Ni-research siguro niya yung tawag doon.
Yes, Doc. Did I pronounce it correctly, Doc Anna?
Uvula.
Oh, uvula. There you have it. Okay, merong nana or sugat sa kanyang uvula. So ano po ang dapat niyang gawin, Doc?
Alam mo, ito yung dinedescribe kanina ni Dr. Tech, yung parang may singaw. No? Baka dun sa, yung uvula kasi is the one in the middle. Parang when you open your mouth and parang thing that's hanging in the middle is the uvula. So dun siguro nakita nung ating viewer yung singaw dun sa lalamunan ng kapatid niya. So typically, yung ganyan, pag singaw, pag kailangan kong pumusta, sasabihin ko viral yan. So supportive po na ako. And then we'll see how it goes. After several days, if it resolves, then that's fine. If not, then maybe it might be worth giving an antibiotic, especially if the symptoms progress.
Okay.
I just want also to add that this is the best example where you have a localized disease. Very clear ang ating participant. It's just in the uvula. So I'm concerned it can be something as simple as an ordinary singaw. If it's an ordinary singaw, it's the best scenario to prescribe your hexetidine on your own. You can already start your hexetidine or your oral antiseptic. And if it's an ordinary singaw, ito pwede dito, Apple, 100% should be gone in not more than 2 weeks. But if the lesion persists, it might not just be an infection.
Yeah.
It might be a lesion that has to be looked into. So as early as now, ang uvula, madali, yun po yung bell, as Dr. Anna said, when you open your mouth, madaling makita, nasa gitna, nakahang na ang tawag ng mga tao, bell. Akala ng iba, yun ang tonsil.
Yes, Doc.
Yun po ang uvula. Napakadali pong makita nun sa camera ng telemedicine. So kung talaga pong tayo ay concerned, ako po I would advise na mag-telemedicine po tayo sa ating doktor kasi kayang-kaya naman pong makita on camera ang uvula.
Yes, I agree,
As I
Doc.
said, agapan with Hexetidine or your oral antiseptic.
Yes, I agree, Doc Anna and Doc Tech. So please have it checked as well. Like what Doc Tech suggested, you can go check out telemedicine, right? Online. You don't have to go out if you're afraid of exposure or anything. Please check out our online telehealth services available. So, okay, let's move on to our next question. So, Doc, what are the possible effects of prolonged use or frequent use of hexetidine, especially on the tongue? Meron po bang side effects or possible effects? Doc
Classmate?
Anna?
I'm thinking about yung mga worst case scenarios, and typically kasi it's a very well tolerated, very safe agent. Siguro na lang kung nilunok mo siya ng napakarami, doon ka magiging concerned, no? Pero in most cases, the reason why it's prescribed, or rather it's used, and it has a very long record of safety is because it's very well tolerated. Wala namang dapat mga masyadong adverse effects or side effects. Etch, you want to add?
Yeah. So I think here also classmate and Apple, the user is concerned about probably how long it's safe to use, because
Yes, Doc.
what are the possible effects of prolonged use. So it's just for any oral antiseptic, since these are adjuvant microbial killers, I always advise that honestly, they are not for maintenance. Pag may nararamdamang sore throat or any singaw or irritation in the mouth, or as prescribed by our dentist for plaques, because hexetidine is also very good for dental plaques,
Okay.
dapat use lang as prescribed by the physician. Gusto ko lang pong i-point out, hindi po ito pang maintenance, sapagkat po ang ating pong bibig at ang ating lalamunan ay talagang may tinatawag na normal microbial flora. Hindi po sterile ang ating bibig at lalamunan. Meron po talaga tayong mga natural na bacteria, viruses na namamahay dyan. Sila po ay hindi nagkokos ng disease. Peacefully existing po siya dyan. Pag tayo po ay masyadong matagal ang gamit ng mga antiseptic gargles, pati po yung mababait na bacteria at viruses na natural na nakatira sa ating bibig at lalamunan ay maari nilang mapatay. At pag napatay po ito ng prolonged use, pwede po tayong magkaroon ng tinatawag na opportunistic organisms. Pwede po tayong magkaroon ng difficult to treat like mga fungal infections with overuse of antimicrobials. Pero yun nga po, fungal infections like Candida are also susceptible to hexetidine and our oral antiseptics. So, yun lang po, reminder. At saka, minsan po, ang effect, pwede po kayong magka-burning sensation in the tongue. Minsan po, pwede rin pong maka-alter ng taste pag prolonged use. So, use it only when you have symptoms and or as prescribed by your physician.
Okay, thank you so much, Doc Tech and Doc Anna. Ayan, so many informations. I hope everyone's taking notes, or kahit naman hindi, you could always go back to this Facebook Live. And now on to our sixth question. Doc Anna and Doc Tech, pwede po ba mag-cause ng sore throat pag palagi kong ginagamit ang voice ko or pag sumisigaw palagi? Ayan, pwede bang mag-cause ng sore throat pag laging sumisigaw?
Napakadaling sagutin yan. Yes, pwede iha. Kasi talagang we use, there is stress when it's like para kang umiiri lagi.
Yes, agree.
There is stress in the muscles, there's stress in the fat, there's stress in the neck. So pwede talagang magka-sore throat, pwedeng magkaroon ng maga. So lagi, lalo na kung puhunan ang ating boses, kami ni Doktora Ann, mga guro, teachers, si Apple, host,
Yes.
ang ating mga call center agents, ang ating mga service providers who always have to explain. You always try your best to keep your voice in moderation and always drink lots of water while you are talking. No extremes.
Yes, Doc. Thank you, Doc Tech. Ayan, a reminder to everyone, wag po kayo sigaw ng sigaw. Okay, lastly, really quick. So, does allergic rhinitis cause sore throat? I think we've covered this one earlier, but for the benefit of those who just came in our Facebook Live, okay, Doc, does allergic rhinitis cause sore throat, Doc Anna?
Yan, feel ko yan kasi sakit yan ng mga anak ko eh.
Yes.
So my kids are really quite atopic, no? They have a lot of allergies. And in fact, one of my kids right now has been complaining of sore throat. And true enough, when we talked about, sige, what else are you feeling? She's actually been feeling a little congested. So sabi ko sa kanya, ay nako, sa tingin ko, post-nasal drip yan. So we better manage that. So the answer is yes, no? And of course, part of the management should be addressing the root of the problem, as Dr. Tech has said, and that should be managing also the allergic rhinitis symptoms.
Thank you, Doc Anna. So last na to. This is very, okay, very, very important. So is bad breath related to a sore throat infection? Doc Tech?
Oh, yes, definitely. Bad breath, or what we call scientifically as halitosis, can result from infections of the nose, the mouth, and the throat. So sore throat can cause fetid odor even. Classmate, right? In bacterial infections, talagang foul-smelling breath can result from throat infections. That's why, again, oral antiseptics like Hexetidine not only serve to hit the root of the problem, but to make the patient more comfortable, make him or her more confident.
Yes,
Kasi
agree.
ang hirap din ng ganun ang sitwasyon.
Yes, Doc. So, okay, so once again, so keep your Hexetidine handy, you know what to do. Okay, so thank you for all of those interesting and insightful questions, everyone. I know everyone is, so concerned about their health. And of course, we all want to know how to stay safe and healthy during this time. And thank you once again, Dr. Anna and Dr. Tech for being here with us today and answering our questions, of course, from the viewers, as well as my personal questions. Ang dami nating natutunan ngayon sa Sore Throat Management 101. So, Doctoras, any last messages to our viewers before we end our Sore Throat Management 101?
Well, if you'll allow me, no?
Yes.
I'd like to thank the organizers for inviting us tonight. It's been a lot of fun talking to you and, of course, to Tech. No, this is not a thing that happens every day. Tech has mentioned we're classmates, and it's really a good opportunity to work together and to share this information about sore throat. So maybe I'll go back to the infectious disease aspect as a last reminder. Alam mo, we're in the middle of this pandemic. A lot of people are scared about getting sick, no?
Yes.
And siguro yung message from this particular discussion is we need to be conscious about the stuff we feel, no? We need to be observant. And for those symptoms that can be managed at home, early intervention can be helpful. Soothing remedies can be helpful, and particularly with respect to sore throat, no? Lalo na kung infectious yung etiology or yung source, then oral antiseptics like Hexetidine can play a role.
Dr.
Yes, thank you also to everyone who came tonight despite the many webinars that you've already seen and attended. Maraming salamat sa organizers. I would just like to say, in addition to what Dr. Anna said, that prevention is still better than cure. All of us, for our families, please stay safe. Practice all the scientifically founded methods for keeping safe. And also for those, I haven't mentioned it yet, please stop smoking to those who are still smoking, because cancer of the throat is still a very significant and an agonizing disease. Kung tayo lang po ay sore throat, mostly po yan po ay madaling solusyonan. Majority po ay mild lamang. There's a lot of room for supportive management. Agapan po natin agad with hydration, rest, and oral antiseptics like Hexetidine.
All right, thank you so much, Doc Anna and Doc Tech. And once again, to all of us and all of our viewers, remember that sore throat on its own might not seem too serious, pero as we learned, pwede itong lumala pag pinabayaan. That's why it's important to treat it on the onset and not with home remedies either. So we need to address the root of the problem with oral antiseptics like Bactidol. It is able to kill sore throat causing viruses in as fast as 30 seconds and protects the throat for up to 12 hours. So thank you once again for tuning in. Everyone, thank you for tuning in here at our Bactidol Sore Throat Management 101. Do not forget to follow us on Facebook and Instagram for more information about treating sore throat and get your Bactidol products at our Watsons online or branches near you. So once again, stay safe and stay informed, everyone. Thank you, Doc Anna. Thank you, Doc Tech. And of course, thank you, J&J and Bactidol.